My name is Alexis Benitez, and I will be covering how vaccines and insurance companies should be related. The purpose of this speech is to shed light on possible ways to combat the possibility of a measles or other preventable disease outbreak. If you are a diabetic, all related problems may not be covered by your insurance. If you are born with a heart condition, all related problems may not be covered. If you had cancer, all related problems may not be covered. If your parents choose to not vaccinate you, all related problems will probably be covered. As it stands right now, people who have health insurance that contract measles or any other vaccination or vaccinated disease will most likely get full support capital-wise from the insurance companies. And according to the World Health Organization, they said there is arguably no single prevention health intervention more cost-effective than immunizations. Time and again, the international community has endorsed the value of vaccines and immunizations to prevent and control a large number of infectious diseases and increasingly several chronic diseases that are caused by infectious agents. So I believe health insurance companies should require patients to vaccinate their children in order to receive certain plans. Many people believe not getting vaccinated does not matter or doesn't affect anyone other than the person not getting vaccinated. But in reality, it is affecting everyone. Many people believe in the herd immunity, and that if they don't vaccinate their one child or two children, they will still be okay and won't have the side effects that may contract from the immunization. But this spread through a whole community, the herd immunity will no longer be valid. Why should insurance companies care who is vaccinated or not? Well, they care who has a past disease because the disease may one day resurface and cost money. Measles can resurface at any time and has in many communities, and could potentially cost the insurance company thousands, if not millions of dollars collectively. According to the Center for Disease Control, or CDC, from January 1st to April 11th, 2019, over 555 individual cases of measles have been confirmed in 20 states. This is the second greatest number of cases reported in the U.S. since measles was eliminated in 2000. But measles is not the only vaccine children receive and may have a chance of contracting. Some examples are chickenpox, or the varicella vaccine, diphtheria, tetanus, and pertussis vaccine, otherwise known as DTaP, hepatitis A vaccine, hepatitis B vaccine, Hib vaccine, human papillomavirus, or HPV vaccine, influenza vaccine, and of course, measles, mumps, and rubella vaccine, or MMR. I do believe people who choose not to vaccinate their children should have insurance. The child should not suffer for someone else's decision. But many places are making it more difficult for parents who decide not to vaccinate their children to not be able to infect other people or children. For example, many public schools require vaccinations in order for a child to attend the school. But I think they should need to pay a higher copay or premium, basically a liability fee for the insurance company. In turn, I would hope this would make people think twice before not vaccinating their children because there are immediate consequences. In some of the research I have done, many excuses are there not being any immediate reasons to not vaccinate. It is very rare to get measles, they say. If they need to pay extra to put other people and their children at risk and make it harder to do, I think this is a good idea. In some parts of the country, you need to jump through hoops, and states require multiple reasonings for why you or your child are not vaccinated. But in other states, it is fairly easy to fly under the radar when it comes to these issues. But one thing that is common in almost all states, you can still receive health insurance in the same regard as everyone else. Now, I'm not saying people who choose not to get vaccinated should not be able to get health insurance at all, because honestly, they may need them more than others. But is it fair that people who have diseases they can't control may have a harder time paying for doctor's visits than someone who chooses to take the risks of these diseases? And lastly, the CDC warns one case is enough to cause concern in one community.